The long head of the biceps crosses the humeral head at approximately a 30-degree angle and enters the bicipital groove. It has a synovial sheath that surrounds the tendon and a transverse humeral ligament that holds the tendon in the bicipital groove. One thing to keep in mind is that the humerus slides over tendon during movement, not the reverse. It functions when there are high loads being placed on the biceps during abduction and external rotation. It becomes very important during the deceleration phase of overhead throwing in that it helps to control the elbow velocity eccentrically. 4 basic injuries that we're going to see to the long heads of the biceps includes a tenosynovitis, a subluxation dislocation, a rupture, or a slap lesion. Tenosynovitis is an inflammatory disorder of the synovial sheath surrounding the long head of the biceps. Oftentimes it's going to coexist with other pathology of the shoulder, such as rotator cuff issues, glenohumeral joint instability, a slap lesion, or scapular dyskinesis. There's not a lot that you can see with tenosynovitis. If it is a chronic situation, the biceps may begin to atrophy. The pain tends to be localized to the bicipital groove, but it may radiate throughout the entire muscle. The patient will complain of nocturnal pain. There will be pain with overhead throwing, and this is something that is very common in swimmers, especially those that swim freestyle. You will have full active range of motion for shoulder flexion, but you will find that there is a potential painful arc, especially during active flexion. 2 special tests that can be used for this condition include the Speeds test and Jurgensen's test. In Speeds test, the subject is seated or standing with their shoulder flexed to 90 degrees. The elbow is fully extended and the forearm is supinated. As the examiner, you want to place one hand along the volar aspect of the subject's forearm and the other hand on the proximal aspect of the humerus near the area of the bicipital groove. Your job is to resist the subject's attempt to actively flex the humerus forward. A positive finding will be tenderness and/or pain in the bicipital groove. In Jurgensen's test, the patient is going to sit with the elbow flexed to 90 degrees and stabilized against the thorax. The forearm needs to be pronated. The examiner is going to place one hand on the subject's forearm and the other at the bicipital groove. The patient is going to attempt to actively supinate the forearm and externally rotate the humerus at the same time. Again, we are looking for pain in the area of the bicipital groove. Tenosynovitis is going to be diagnosed clinically.